I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor, and I also have bipolar disorder myself. Today I'll be talking about the difference between bipolar disorder and schizoaffective disorder, which I'll refer to as SD. I'm not going to go over full criteria for SD. I'll just talk about the main differences between it and bipolar disorder. I want to help explain the differences between bipolar disorder and illnesses that are very close. So in my last video, I talked about major depressive disorder, and in this one, I'll talk about SD. There are two types of SD, depressive type, where people experience only depression, and bipolar type, where people experience mania and may also experience depression. In this video, I'll be focusing on the bipolar type. I often hear people say they have both SD and bipolar disorder, but by definition, you cannot have both diagnoses at the same time. However, it is possible for a diagnosis of bipolar disorder to be changed to SD and vice versa. So what is SD bipolar type? Well, simply put, it's a combination of the psychotic symptoms of schizophrenia and the affective symptoms of bipolar disorder, hence the name schizoaffective disorder. In 3 previous videos in this series, I described manic episodes, hypomanic episodes, and depressive episodes. And in another video, the one on bipolar 1 disorder, I talked about how people with bipolar disorder can experience episodes of mania or depression with psychotic features. Now, some people with bipolar disorder experience psychosis and some do not. But if they do, they experience it as part of a mood episode, specifically a manic or depressive episode. In other words, people with bipolar disorder don't have psychosis when they're between episodes, at least not full-blown psychosis. People with SD bipolar type also experience mood episodes. They have to have experienced a manic episode along with psychotic symptoms of schizophrenia. And like I said, they might also experience depression. Unlike people with bipolar disorder, they've also experienced psychosis when they're not having a mood episode. Specifically, they have to have had delusions or hallucinations for at least 2 weeks in the absence of a mood episode. In other words, between episodes of mania or depression. People with bipolar disorder may also experience some psychotic symptoms between mood episodes, but they're likely to be mild and fleeting. It can be hard to distinguish between bipolar disorder and SD. A mental health provider has to take a thorough history in order to make an accurate diagnosis. Also, as I mentioned, the diagnosis can switch from one to the other. I want to point out that SD is a controversial diagnosis. It doesn't have great reliability or validity as a disorder. In fact, it's not even clear exactly what it is: a distinct disorder, a subtype of a disorder, or a combination of disorders. In this video, I've just given you the basics of how it's currently understood. So those are the major differences between bipolar disorder and schizoaffective disorder. Thanks for watching, and here's to good mental health.
Schizophrenia. Schizophrenia is a serious mental illness that affects about 1% of the population. People with schizophrenia interpret reality and may result in some combinations of hallucinations, delusions, and extremely disordered thinking. Resulting in behavior problems can impair functioning, be disabling, and many people may not respond well to traditional treatment. My assumption is that more people that have it, more than 1%, just 1% of the population has to get tested or goes to the hospital. Positive symptoms of schizophrenia, same for psychotic psychosis, and are sometimes referred to as psychotic symptoms. These may present any or different psychosis and are often transcendent, making early diagnosis of schizophrenia, which is problematic. Hallucinations, these may include people hearing voices, seeing things, smelling things, can't perceive the hallucinations. The hallucination may be a real person or experiencing it and may be confusing to a loved one or witnesses. The voice of the hallucination can be critical. Threatening voices may people that are known or unknown to the person hearing them. The smelling thing I've never had. Seeing stuff I've had, which can be a lot of things. A person, a false belief. You may feel mice, other things on your body. You may see animals, a person right there. You may see somebody flying. You may feel like you're flying. Does that sound weird? It's true, though. These are false beliefs that don't change even when the person holds them present with a new idea of facts. People delusions often also have problems concentrating or confusing or thinking, or that their thoughts are blocked. The FBI is after me happens a lot. Negative symptoms are diminution person abilities. Negative symptoms often include people being emotionally flat, speaking disconnected way. People with negative symptoms may also be unable to start or thought with activities, show little interest in life, or sustain relationships. Negative symptoms are sometimes are confused with clinical depression. Flat as it was during my first psychotic break, starting to follow directions can always be hard, and remembering the directions can even be harder. The symptoms of schizophrenia are usually classified into positive symptoms. Any change in behavior, thoughts, or hallucinations. Negative symptoms where people appear to withdraw from the world or take no interest in everyday social interactions. Cognitive people with cognitive symptoms of schizophrenia often struggle with remembering things, organizing their thoughts, or completing a task. Commonly with schizophrenia,
anosognosia,
or lack of insight. This means that a person is unawake, or that she or he has an illness which can make it treating or working with these individuals much more challenging. Research suggests that schizophrenia may have several possible causes. Genetics isn't caused with just one genetic, but complex interplay. Genetics and environmental hereditary does have a strong role. Your likelihood of developing schizophrenia is more than 6 times higher if you have a closer relative, such as a parent or sibling with this disorder. Would be my grandfather or maybe some other parts of my family, I don't know. Environment, exposure, viruses,
malnutrition,
birth of the first and second timers has been shown to increase the schizophrenia of recent. Research also suggests between autonomy disorders of developments of psychosis. Anything to do with schizoaffective would be high school, a very somewhat traumatic experience. Problems with certain brain chemicals, including called dopamine glutamate, may contribute to neurotransmitters allowing brain cells to communicate, as well as which either networks or neurons are likely involved in as well. EMDR is a good use of forgetting the symptoms, and it makes your brain like evaporate the symptoms and makes headaches go away, and that is a good thing for trauma therapy. Some studies have suggested that taking mind drugs during teen years in young adulthood can increase the risk of schizophrenia. A growing body of evidence indicates smoking marijuana increases the risk of incidence and the risk of ongoing brain psychotic experiences. The younger and the more frequent use of greater risk it is. Brain chemistry would be something of a learning disorders. A sour substance, I'm not into drugs, but can really impact you, and including marijuana. It's a drug, whether weed is a kind of different because most young people without schizoaffective may not have a psychotic break, but people with psychotic feelings may have a psychotic break. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health Day. This is Sam Vaughn.